And then we also have with us Dr. Eva King, who is the director of Rideau State Health Laboratory. So Dr. King will be here to help with any of the specifics on the variant. So with that, I'll kick it to Dr. McDonald.
Yeah, thank you, Jonah. Just good afternoon, everybody. Thanks for joining us. It's good to have you here today. You know, so we've learned today, and you saw this in our press release, that Rhode Island has identified the variant called B.1.1.7, which this is more commonly known as the variant that's was identified in the United Kingdom. Just for context, 40 other states have reported this variant. So it's new for us, but not new for the United States. You know, I just want to differentiate this. We have not yet seen variants from the South African strain, which has been reported in 8 other states, or from the Brazil strain, which has been reported in 2 other states. You know, this is not surprising. You know, one of the things I've talked about in various media outlets is we knew the variant would come. And quite frankly, it's not surprising. This is part of the thing you see as the virus comes across the country. It's a contagious virus. It spreads from person to person. So we see this. We did identify 3 people. We're not releasing their names yet. 2 were from Newport County. 1 was from Providence County. They're still under investigation. You know, we don't have a lot more data on that right now. One thing I just want to remind people about what a variant is, because I think it's just important to understand when we talk about a variant, what are we talking about? So we're talking about the same virus, SARS-CoV-2, but the genetic structure is a little bit different in the binding protein. And so it's just important to understand that's the difference. And it's called a variant because it's a little different genetically. Now, just keep in mind, again, for context, viruses naturally change. That's called mutation. Their genetic structure naturally changes. And this is just important to have a little context on that. This is not surprising. You know, Dr. King's going to talk about this in a minute, but her lab's been great at looking for the variant. We've been sending specimens to the Broad Institute, some to the CDC, some to Dr. Cantor. So we've been looking for it. So we found what we were looking for. It's important just to have people know this. I think it just underscores some important things, though. Now more than ever, it's really important to have a high quality face mask. So, you know, I'll just throw this for an example. Like I wear a KF94 sometimes, and sometimes I wear another mask. It looks like a N95, you know, a non-medical grade N95. And I think those are important. I think other things people can do, we talked a little bit about this too, is double masking. You know, double masking when you take your cloth mask. I have this one here, a neighbor gave me, my Dr. Fauci mask. I'm not sure why the neighbor thought I needed this. And then I got a medical procedure mask. So if you put these 2 together, you've got a double mask. So improving the quality of your mask, a cloth mask by itself is okay, but double masking is better. And then using a high quality mask like a KF94 or a KN95, that's really the best. This is what I do when I'm out in public. So I want to make sure people know that. I think it's also important to remember we care about ventilation. We want to make sure you have an adequately ventilated space. And it's important just to limit how long you're in any particular place. The less you're in a place, the shorter your duration of time, the better it is for you. I want to just touch a little bit on a slightly different topic, though. You know, the vaccine rollout in Rhode Island's been in the news lately. And I just think it's important that people have a little bit of context about this. So the strategy that we're employing, you know, we were transparent in the beginning. This is what the Department of Health was doing, right? Targeting very vulnerable people in nursing homes, assisted living, people who are most likely to pass away. And then people in various occupations, mostly healthcare workers. But it turns out there's over like 100,000 people in all those various occupation groups. So it was a very deliberate, targeted, and strategic approach. Now, Joe Wendelkin has a slide. Joe, would you be so kind just to show that slide for just a minute? I think this graphic is something that I think people will find this helpful. And I just want you to take a moment just to gander at this and take a look at this here. So as of February 15th, yesterday, we've administered 103,000 first doses, 151,000 total doses. But because of the targeted approach to reach the most at risk, we're not seeing a significant higher reduction in hospitalization than our neighboring states. And you know, West Virginia is not a neighboring state, but because they're the state that's really leading the pack in vaccination, I think it was important to include them as context. So if you look at our average hospital admission change since January to today, we're down 46%, excuse me. West Virginia is down 35%, the United States down 32%, and our neighbors in Mass and Connecticut down 22%. So keeping people out of the hospital is really important. I think that's This is important because one of the things I think we just need to differentiate is there's a difference between public health outcomes and then public health activity. Public health activity is important. And, vaccination, counting doses, that measures a process, and that's important. Outcomes are, though, what I think people should really pay attention to. When you look at our positivity rates in Rhode Island from November to February to date, we're down quite a bit. When you look at daily cases, we're down quite a bit. Look at December, 1,000 cases, a day. Now we're down to 400 a day. I'd like to see it much lower. Don't get me wrong, but I think it's important just to have perspective on this. When you look at daily hospitalization, in December, I saw 62 folks end up in the hospital every day. Now we're about 29. Again, I'd love to see that number lower, right? When I look at daily deaths, I lost 15 of my friends every day in December. That was hard. When you look in now, we're seeing about 7. Again, I'd love to see these numbers at 0. And part of why I want to have perspective here is I just think it's important as we think about this shared experience we're all going through. Keep in mind, the whole planet, the country, the state are going through a population trauma. This is a very traumatic time. Everybody experiences pain every day from the pandemic. And I just want to make sure you know that this can create a time where we get frustrated more easily, anxious more easily, angry more easily. And I think it's important to think about that leads your mind to places that, quite frankly, as your state's doctor, I got to talk to you once in a while as your doctor, that isn't good for your mind to go places like that. I live in a place where my mind is focusing on being thankful that I have 2 safe and effective vaccines for you. My mind goes to teamwork and collaboration every day. In my mind, I live in a world of joy because I can, and I try to have appropriate perspective on my life. I'm going through the same pandemic you are, but I try to have a positive approach towards what I can change and what I can do. And part of why I want to leave you with that is I think when you think about what a lot of people are talking about is they're frustrated and angry about the activity and the process. And we're going to do our best to improve that. I know people are frustrated. I really hear that. I get it. People email me. I read your emails. I get back to you. But I want you to know that we are doing what we can to make this go as fast as possible. I think you're going to see it speed up more this week, more next week. Definitely as we get more people going by the age-based approach, it's going to go a lot quicker. Keep in mind, the way this thing started was very deliberate. We told you how we're doing this in the beginning. It was a pull system. We pulled in various occupations. We pulled in the firefighters. We pulled in law enforcement. We pulled in funeral workers. We pulled in healthcare workers. We pulled all these people in. It was a laborious process. I think it's important, though, to have a little bit more context. Like when I look at some of the other data I'm seeing, the vaccine's definitely helping. We're seeing much less cases in healthcare workers. I think it's important to remember, healthcare workers were exhausted. This pandemic's hard. You walk around in that gown, that mask, those gloves, those goggles all day. It takes a toll physically and emotionally when you see your patients not doing well. But we've seen a 66% decline in healthcare worker cases. In our nursing home residents, we've seen a 55% decrease in long-term care facility cases. So, that's important to have context. And then my friends in Central Falls, come before Thanksgiving, I was looking at a model with our epidemiologist that showed Central Falls, 100% of the folks who have been infected with SARS-CoV-2 by January 31st. That was before Thanksgiving. We had to do some things. We gave them masks, high quality K95 masks. We did what we could, but we also did a lot more vaccine there. And the cases in Central Falls are down 64%. And I think it's just important to have perspective about this. We're seeing nice decreases in a lot of outcomes here. Now, we want to see these outcomes go in the right direction. Now, keep in mind, no one is surprised that the SARS-CoV-2 variant is here. We knew it was coming. We know it's here. We are not powerless to address this. And right now, the monoclonal antibody treatment we have will work against this. So if you get infected, there's every reason to still seek treatment. Go get treatment with a monoclonal antibody. Ask your doctor. There's every reason to believe we can get you treated today or tomorrow. We're having nice availability on that. The vaccine works against this as well. And we're doing everything we can to roll as much vaccine as quickly as possible. We had a lot of calls today, a lot of calls yesterday. I see a lot of good things happening here. I'm going to stop there and just see if Dr. King has a few words she wants to say. Dr. King, do you have a couple words before we open up to questions? Because I do know we do want to open up to questions as soon as we can here.
Yes, thank you, Dr. McDonald. Just very quickly, in Rhode Island, in mid-December, when we have first heard about the new variants, we have quickly put together a plan for what we call genomic surveillance. We have enlisted a few local and out-of-state resources, laboratories that can provide sequencing for us. We are contributors to the national surveillance through the CDC laboratories. And we also partner with the Broad Institute, where they are able to sequence large numbers of specimens for us on a weekly basis. So that is really how we found those new variants. As Dr. McDonald mentioned, that it's not an unexpected finding. We fully anticipated that this was going to happen in a matter of weeks. So that's
Thanks, Dr. King. So let me just open it up for questions. Folks, I can be here till 4, then I have to give a talk somewhere, but I want to stay as long as I can. How can I be helpful today, my friends?
Yeah, Dr. McDonald, I don't know if you can sort of give us a timeline specifically when this was identified. When did you have the first person come forward, or I guess the first lab result? Did any of the 3 people's symptoms vary from what we've seen typically so far from the, I guess, typical strain of COVID-19?
Yeah, Bill, thanks. I'm going to take part of that and let Dr. King take part of it, okay? So we don't know anything about the symptoms. We haven't done investigation yet. That's happening. We do know, roughly where they lived. But as far we learned about it, I learned about it today. Dr. King, I think we learned about this just today. Can you tell us what we learned about this, Dr. King?
yes, we learned about those findings late last night.
Yeah, and Bill, just to be clear on that, the patients don't know they've been identified with the variant yet because we haven't told them yet. And it's not going to matter for them, like they've all cleared the isolation period. But it's important, I think, just to have context is, folks, this does spread a little bit more aggressively. It spreads more contagiously, and the morbidity, mortality, it's not what it is. The fact that all of our trends are heading in the right direction makes me believe it's not widespread in our state yet. In other words, things have been going in the right direction, but I really need to keep it out of our state. And I really want to get back to this one thing. If you're thinking like, what's the one thing I can do? Just say you only have time for one thing. You can only listen to me saying one thing to do today. I really need you to upgrade your mask. If you can upgrade your mask, you go to a major online retailer, buy a KN95 or a KF94. We're passing them out at testing sites, by the way. So if you go to our testing sites, you can ask for one. They'll give you a high quality mask. That's one thing you can do. That's one thing you can do, and that's probably the best thing you can do. Who has the next question?
I had a question, Doctor, and this is Rob Nesbitt from Channel 12. The timing of it, it looks like it's expected to be the dominant strain by March, which is the very middle of the state's vaccination process. You talk about how the vaccine is effective against it, but do you see this new strain affecting vaccinations in any way?
Yeah, I don't know that it's going to be the dominant strain by March. I think we have to say, look, I would give it 90 days to become the dominant strain. Having said that, let's not concede defeat. Rhode Islanders, we're strong. We don't concede defeat, right? I feel like we're not the same people we were last March, my friends, right? Last March, this whole thing was new to us. We're smarter. We're better prepared now. So if I can get everybody to wear a high quality mask, it is not a foregone conclusion. We cede this ground to the enemy. So I think that's important. The vaccine is still effective. The Pfizer vaccine, the Moderna vaccine is still effective. I don't think it changes us too much though, because we want to roll out as much vaccine as quickly as possible. Everybody is in agreement with that. No matter what you're reading in the news, I promise you, everyone at the Department of Health wants as much vaccine going out as quickly as possible. And I think you're going to see that. So it doesn't change what we're going to do. It just makes, if anything, we're growing as fast as we can, but I think we're even going to go faster next week. Who has the next question?
Hey, Dr. McDonald, this is Darren Botello with ABC6. I was just wondering, I know you said you don't think it's widespread right now in the state, but, and those people that are infected, the 3 people don't know yet. But do you think that, through contact tracing, you're going to find more people? Have you guys already started the process?
Yeah, so the case investigation is going to start. And so we might find more people, but keep in mind what we're trying to do. Maybe I should have Dr. King answer this a little bit. Sequencing a genome is not like a lab test you just do just like that. It's a very laborious thing to sequence genome. It's Star Trek medicine, to be sure, my friends, right? You're actually sequencing the entire gene. So it's not like it's like a CBC where I can put it in a little machine, have a result in 30 seconds. Dr. King, can you talk a little bit just quickly about how to sequence a genome? This is quite a procedure.
So this is a very resource-intensive test. It's not intended for clinical use. It's not intended to be used to figure out who has that strain or not. It is really used for surveillance purposes. So what we want to know is which of those variants are circulating, whether it's the UK strain or some other strains that might be more benign. We do not intend to test every single person who comes down with COVID with sequencing because it's not really feasible. It requires specialized equipment. It requires a lot of computing powers. It's not fast enough for clinical use and has no direct implications.
Yeah, thanks, Dr. King. And I think just to underscore a point, it doesn't change how we treat people. In other words, the treatment stays the same. Our vaccine plan is going to go faster. Let me just stop there. Who has the next question?
I'd like to clarify on that, Dr. King. This is Sophia Rudin from the Publix Radio. How many of these sequences are you doing per day or per week? What's the sort of denominator that these three are out of?
Right. So our genomic surveillance program is ramping up to 100 plus every single week. That's something that we're aiming for, and we are pretty close to it. We are looking to capture a representative sample of the positives throughout the state, so not just from our laboratory, but from other commercial laboratories as well, to capture different clinical settings and geographic distribution.
Thanks. Who has the next question?
Patrick, you're on mute.
While Patrick's waiting, does someone else have a question? Because we'll get to Patrick. We won't forget you, Patrick.
I'll ask another one, Dr. M, if I can.
Please.
Yeah, you talked about how staying inside and limiting your time inside with this variant. Restrictions have just been eased for businesses like restaurants. You're allowed to be inside a restaurant for 90 days. Do you see this new strain affecting restrictions?
Yeah, not right now. I think right now, we're going by the outcomes we're seeing, which is the cases and hospitalizations. So right now, I don't see these restrictions. And by the way, I was out to dinner recently, went to Providence Coal Fire Pizza. My wife loves the salad there, the little lentils and hummus thing. It was great. I just think it's important that people know that, use your common sense, but if you want to go out to eat, go out to eat. Takeout's not a bad idea, folks. The restaurant industry is hurting. I think it's just a good idea. I mean, I almost could be so bold to suggest a takeout Tuesday. Tuesday is known for so little. Why not make it known for something special? And I just want to be sensitive to the restaurant industry. Today's Tuesday. Why not a little takeout Tuesday, huh?
And Dr. McDonald, I know you said obviously the vaccine works against the variant from the UK. What about South Africa? And are we expecting to see that in the state soon?
Yeah, we're looking for the South African strain. We haven't seen it yet, and we've looked for it specifically. Like we had some experience with people who were positive from South Africa. We did not see it with them, so that's a positive. The vaccine right now, the results I see so far look like the vaccine will work against some of these variants. And part of what I want to just say about that is you look for real world experience. And since you don't see a lot of South African virus in the United States, right now it's only in 8 states that I know of. We have to, temper that a little bit, but I'm still optimistic about the Pfizer and Moderna vaccine. And I just want to underscore that, folks, we're going to have the birthday for this thing, February 28th, right? And I just think like, if I had said to you, we're going to have 2 safe and effective vaccines before the first year of this, I think most people would have signed up, said, good, that's good, right? And if I told you, by the way, come summer, almost anybody who wants a vaccine is going to get one. I think everybody would have signed up for that too. And part of what I underscore that is I just encourage people, just as your doctor, I just want you to frame your thinking a little bit, right? I live in a world of thankfulness, collaboration, teamwork, and joy. And I focus on that with my people I work with. I don't live in a world of frustration, anger, and anxiety. And too many people, too many of my patients in this state are moving in that direction and getting all anxious and upset about the vaccine, not getting into it right away. We hear it and we're trying our best to get it to you. And we're going to improve things, but I just want to caution you, please keep your mind in a resilient position so you can stay ready to deal with this, because the pandemic's been a global trauma for all of us. And I think it's just important to remember, look, we're going to get through this. We're heading in the right direction. And part of why I showed you the slide with the outcomes is, folks, the outcomes are what matters. That's the stuff I look at. And when I look at the outcomes and the people we vaccinated, very positive. So we're seeing nice results. And so I think this is a really good thing. But I want to hear another question. Who's got another question? Patrick, were you ready yet? Patrick, we still can't hear you.
I'll jump in. how widespread do you think this variant is in the population at this point, Dr. McDonald?
Yeah, Sophia, it's hard to say. My guess is not very widespread right now because everything's trending in the right direction. What you saw in the United Kingdom is when they had this, it became the dominant strain, things got a whole lot worse. And that's why I really don't want to seed the ground on saying this is going to be the dominant strain in my state. I don't want to seed that ground, my friend. I really think we need to stay focused on saying, look, I'm going to upgrade my mask. And part of why I keep driving that point home is I really do need every Rhode Islander to think about this sometimes. I need you in the game right now. If you've been sitting on the sidelines, half-heartedly dealing with your pandemic preparedness, I need you to get in the game. Because right now, what the coach is telling you is, hey, the enemy just got a little bit stronger. I want to win this game. I really need people to do something positive right now. You can do something. We in Rhode Island, we control our own destiny. We all upgrade our mask. We have the power to overcome and protect ourselves. And I think that's a positive right now. And this will protect against the flu and everything else too, by the way. Ted, are you really raising your hand? Okay, let's go with Ted.
My question, Dr. M, though, is, we hear you about not getting frustrated, but one of Dr. Gottlieb, Dr. Jha, everyone says part of the reason for speed with vaccinations is to avoid. Dr. Gottlieb has said on Face Nation, it's the best way to avoid this taking off really fast. Isn't it valid that people in Rhode Island are frustrated to see the state has hit the fewest people per capita in the country?
Yeah, it's valid that people are frustrated. I think it's important to understand that the approach we took, we told you what we're doing. We've been doing vaccinations for 63 days. We were very transparent about our approach. In other words, people in nursing homes, the most vulnerable, most likely to pass away. But you guys need firefighters. You need a system that works with police officers. You need people who do healthcare. And part of what's, if you look at all the occupations we all said we're doing, it's over 100,000 people. It just took time to pull those folks in. All those folks are vaccinated now. One of the things Rhode Island has as a benefit right now is no matter how bad it gets, you have a healthcare system that's going to function for you. And you have firefighters who are going to deal with all the problems firefighters deal with. You have police officers who can do their job too. You have a lot of people who are really important to our work who are going to be functioning. So yeah, we made a deliberate, targeted, strategic approach. And, but we are prepared to deal with the variant. And I totally agree with you, Ted. I really want to get as many people vaccinated as possible. And I think you're going to see the numbers improve really rapidly. Totally agree with you there. And I agree with every Rhode Islander who believes that. But I think, it's just like, this is what we did. And I think we're going to be heading in the right direction. We have time for certainly more questions. Who's the next question?
I'll try one more. Can you hear me now?
Patrick, I can hear you now, Patrick. Yes, Patrick.
With the variant now here and with so much progress vaccinating folks in congregate care settings, is it time now to widen eligibility and to perhaps reduce that age number down to 70 or even 65 like other states have done and allow those folks to get vaccinated? And if
Patrick,
not, why not?
Patrick, I love the question and I love that point. And yeah, I think you're going to see that 65 or sooner has to happen as soon as possible. So I think you'll hear an announcement from the department very soon on that. Couldn't agree more. In other words, you're asking the right question. We need to get to the next high risk group, right? 75 and older, highest risk group. What I saw in high density communities was 13% of folks who got COVID, 75 and older, didn't survive it. When you look at 65 and older in high density communities, 3% didn't survive it. That's a big number to me. So we definitely need to go after that 65 and older crowd as soon as possible. And then I want to get right into the people with underlying conditions as soon as possible. I want to get those folks. I mean, I don't want anybody to feel like they're forgotten. If you're under 65 and you've got an underlying condition, we want to take care of you. We absolutely do. Who's got the next question?
Dr. McDonald, I imagine that people are going to hear that the patients haven't been told yet who, people have recently tested positive and they're going to wonder if it's them. Is there a plan to tell the people, who it is that has a variant?
Yeah, so yes, Ryan, thank you. Yeah, we will tell the people they were positive, but, I think keep in mind, folks, there was 3. They've already cleared isolation. So it's not anyone who's tested positive recently. So, fair question. And, as soon as we can, we'll let people know. I think I saw Rachel had a question next. Was that right, Rachel? Did you have a question?
Really quick, tomorrow's Ash Wednesday. Do you have anything you'd say to Rhode Islanders about, obviously we're a very Catholic state, anything about whether or not you should attend service in person, consider an alternative, just anything you'd say to that?
Yeah, Rachel, I really respect everyone's spiritual journey and I encourage people to pursue their spiritual journeys. That's very meaningful to people. And if you do want to go to mass, God bless you, go. Pray for the state and the nation, by the way, while you're there, because we'll take all the help we can get. Do try to be 6 feet apart from everybody. That's really important. And if you do go, maybe just hit the head, upgrade that mask, right? You just got to upgrade that mask. I think it's really important to do that. That's the best thing you can do to protect yourself. And something to think about, Ash Wednesday is very physical because people want to receive the ashes. But if you could attend virtually and get the same spiritual journey, that would be safer for you. And for some of my older friends in Rhode Island, in other words, some who are 75 or older or have underlying conditions, I highly encourage those who are more vulnerable to think about that virtual spiritual journey as a more meaningful one. In case you're curious, when the McDonald family goes to church, we do it online, and we do it from our living room. And I found it to be, it's just as good for us. We find it to be just as satisfying. So I think it's very important for people to have an honest spiritual journey, and I encourage them to do that. Thank you. Who has another question? I have time for one more.
With bars open, and you're saying that this revelation today of 3 UK variants in the state wouldn't impact the decision to slightly open bars. There's been a lot of service workers who have asked if, like in Detroit, service workers could be added to the next phase of vaccinations. Is that something that could happen concurrently as we ease restrictions? Those workers who are working inside restaurants, particularly bar rooms, may also be added to the vaccine list.
Yeah, Bill, thank you. So let me highlight a couple things. One, if you're a bar owner, please enforce our regulations because that's really important. Second, Bill, no, we're not going to be adding more people. And I want to just throw this out because I think this is a great point that Bill's bringing up. If you're really frustrated why the vaccine process is going so slow, if you're frustrated, it's because we kept pulling in these different groups. So if we pull in one more group, people who work at bars, are basically saying yes to people who work for a bar, but no to someone 65 or 75 or older. And that's going to slow us down. But also, we're not vaccinating the highest risk individuals. We really want to focus on vaccinating the highest risk individuals because really, when you get right down to it, I need to save as many of you as I can. I want to keep as many of you out of the hospitals as I can. That's really what we need to do. So it's a fair question. I love it. But we're not going to be changing our vaccine strategy. Right now, it's age-based, as many as possible, as quickly as possible. It's the whole pandemic is a marathon. This virus is going to be something we're going to live with, but we got to get this thing under control. But we really need to have a sprint right now about vaccinating as many people as possible. Folks, I actually have time for one more question. I said I didn't, but I have 3 minutes till I have to give a talk, so I'll take one more.
Doctor, what are you Tyler Dumont from NBC 10. What are some of the questions you're going to be asking in your contact tracing efforts for these 3 people? And right off the bat, do you believe at this point that they are connected, any of the 3? And, will you be looking at things like travel or, how this virus got here, the variant?
Yeah, Tyler, thank you. Exactly right. We're going to ask all those questions. We ask them of everybody, though. And right now we're doing thorough case investigation and contact tracing. We'll ask all those questions. We'll learn what we can. And keep in mind, it's only 3 people. Don't expect a lot of detail coming out. We don't really share individual stories. We share population stories. So when it's less than 5 people, we're not going to be getting anyone's story out there. So don't expect a lot of details. But I think that you'll find that we're going to do the same type of thorough case investigation we've done in the past. I can't thank you guys enough for being available today. I really appreciate it. We've obviously had some important news. Just to summarize, Rhode Island has had 3 cases of the United Kingdom variant. We're not surprised by this. I really need people to upgrade their mask. This is new information, but not unexpected information. Thank you so much for joining us today. I hope you guys have a good rest of your day. Bye-bye.